sir. So video করছে
nobody talks.
আমার কাল ল্যান্ডস্কেপ
Horizon.
If you want to describe an instrument, so there are three parts of this instrument. This is called ratchet, where we hold the instrument. ঠিক আছে? This is called joint, and this is called blade. So there are three parts: ratchet, joint, blade. Okay. So see, there are two types of ratchet. One, it is getting locked here. In this instrument it is getting locked, but there is no such thing in this instrument. বোঝা গেল?
Yes sir.
Similarly, there is no such thing in here also. So what is the significance of this lock?
For the
After holding something, say we need to do some other thing, but in the process I have to hold that thing. So it will help in that holding the thing.
gripping or grasping.
Okay, means that you can do a separate thing while using this instrument, but when you are using these instruments you have to, it has only one purpose. Yes, ঠিক আছে, বোঝা গেল? তাহলে let's start with this instrument. So it has a large shaft, it has also a large blade, ratchet is there. And how will you describe the blade? This gap is called fenestration. So the blade is fenestrated, and you can see some lines here.
Corrugation.
So what is the purpose of this fenestration? To hold something. It can accommodate something. ঠিক আছে? So বলুন, it is called, this instrument is called কি বলে?
Holder something.
Any idea?
Something holder.
Something holder. What does it hold?
Cord.
Not cotton. It is called towel grasper. So what is the purpose of this instrument? Before any operation I need to paint the area where I am doing the OP. This instrument is used in that purpose. বোঝা গেল? So this is called towel grasper. So the towel is held here, and then you can use to paint the part of the patient where you are doing the OP. So first it is used. After this, what we need is to cut open the patient. Scalpel. So this is the scalpel holding instrument, scalpel holding forceps. ঠিক আছে? If you see here, there is a numbering given 4. ঠিক আছে?
Yes sir.
So that there is a significance of this numbering. Okay. Similarly, there is also number for
Blades.
this scalpel or blade also. So suppose this is 15 number blade. Okay. So this 4 number, but this will not accommodate this. It is not getting accommodated. Okay. So number 4 is used to accommodate blade number 20 and above. বোঝা গেল? So up to 15 number 3 is used.
Yes.
ঠিক আছে, বোঝা গেল? So after painting the patient, this is the second instrument to be used. ঠিক আছে, বোঝা গেল? So first you are giving an incision with the scalpel Next thing what you will do in any operation, first you encounter is skin, right? Then subcutaneous fat, then subcutaneous not necessarily fat, subcutaneous tissue. After that subcutaneous fat. After that what?
Fascia.
Superficial fascia.
Yes, sir.
After that
Deep fascia.
not
Means
fascia.
not deep fascia, into the organ.
Into the organ, that may be
Space.
organ, that may be
Cavity.
no, not organ, that may be muscle or neurovascular bundles. After that another fascia is there.
Deep fascia.
After that in case of abdomen
Viscera.
visceras are there. তাহলে বোঝা গেল? First there is skin, then there is subcutaneous tissue, then there is fat, then there is superficial fascia, then there is neurovascular bundle or muscle, then there is deep fascia, then there is viscera or anything else, depending upon the which part you are doing the work. ঠিক আছে? So in order to reach the deep fascia or say viscera, you have to go through these layers. The process we do to proceed towards the deep layer, what is that process called? Dissection. It is the mainstay of any kind of surgery. Surgery is not only about only cutting. So this is used to cut open the skin. It has no other purpose. Then comes in dissection. So these instruments are used in dissection. বোঝা গেল? So first what is this instrument? There is a ratchet. The instrument is a small instrument. This is the joint and the blade is small, and look at the blade, it is serrated. Like it was fenestrated and it is serrated. Okay? And if we close it, there is no gap between the blade. Okay?
Okay.
So what may be the purpose?
Scissor or clamp.
It may used to for some clamping. Can it be used to clamp?
No.
No, because there is a certain gap here. So this is used during dissection. This is used to clamp arteries. So this is a miniature artery forceps, also known as mosquito forceps. The original artery forceps is missing here, so I cannot show it to you. So artery forceps just looks like this, but only difference is it is large, and this is called mosquito forceps. So what is the difference between artery forceps and mosquito forceps? Mosquito forceps is used to clamp smaller vessels.
Cap.
বোঝা গেল?
Yes.
So now suppose during the dissection process you are going into your target is say some deeper structure. So in order to reach the deeper structure, I have to remove the structures those are superficial to it. তো আমি যদি those structures remove করতে চাই, will I cut and remove or will I retract it? I will retract it. So here comes this instrument. This is called what? This is called Allis tissue forceps. ALLIS. Allis tissue forceps. So what is its purpose? It is to hold tissue. Look at this. The blade is here toothed. So one thing is clear, I cannot clamp any delicate structure or hold any delicate structure with this because it will lead to bleeding. So this is used to hold tissue. During dissection, it is used to hold the tissue. Once you hold the tissue, suppose this is your structure which you are targeting to do the OP, and certain tissues are above it. So what you are doing? You are holding the structure like this, and then you can remove it. So here comes the importance of this ratchet, because my intention is to operate on this structure. Okay, so there is certain tissue above it. So what am I doing? I am holding this and then I am locking it. Okay, now I am separating it and doing further dissection on this structure. So this structure is getting removed, and now I can do like this. Okay, had it been this instrument, could I do this?
No.
So this is the importance of this ratchet. So I don't have to use it only this. If I have some other purpose, I can use that instrument in this during the process. বোঝা গেল কি বোঝা গেল? Next comes this instrument. Other things are same, only difference is it is gented and at an angle of 90 degree. So it is called right angle forceps. Okay, so what is its purpose? Look at the blade, it is also serrated and there is no gap once I close it. So you can say it is also used to clamp any vessel. So why not this instrument? What is the particular use
For
of this
ease.
instrument?
larger vessels could be
If I want to clamp the underlying artery, that is a factor. And
But also the
if
location.
I want to go, suppose this is a structure, this is your structure of interest. Okay, you are operating from above. You are operating from above, and this is your structure. And suppose, as he was saying, the artery is there. Okay, so if I want to say appendix, so if I want to cut the appendix, I have to first ligate the blood vessel supplying the appendix. So in order to ligate it, suppose the arterial vessel is going through this area. So if I will be using this, so it was not possible to clamp that. So to dissect or to ligate any artery around a structure, that's when the 90 degree comes in place. If suppose the vessel was above it, so I could easily clamp like this. But here the vessel is say below the but not reachable through the artery. That's when this comes in handy. Okay,
Yes, sir.
this is the one purpose. Second purpose means where the mosquito forceps or artery forceps cannot reach, it can reach. That's why see it is larger. There is no miniature version of this instrument like the mosquito forceps. So you can say the mosquito forceps can be used in a surface surgery, but it can be used only in deeper
Deep surgery.
structures. That's why it is long. বোঝা গেল? Now suppose the real use of this instrument, suppose this is a structure, okay, and say this is the blood supply of that structure, okay. So in order to cut this structure, suppose this is a part of the gut or any structure whose blood supply is going like this. So in order to cut this structure, I have to clamp this, okay. So how will you going to clamp this? So you have to first ligate the blood vessel, then only you can able to cut the organ, otherwise bleeding will be there, right? So how will you clamp this? So now as I am showing you, blood vessel to এইভাবে থাকে না, there will be certain fat tissue will be there. So in order to dissect it, so how am I dissecting? This is, suppose here is the fat tissue, here is also the fat tissue, and this is the artery supplying this structure. So I am going to make a hole here by dissecting the fat tissue. Also I am going to make a hole here by dissecting the fat tissue. Then what? Then I will put the instrument through one hole and release it through this hole, and I will ask my assistant to put a suture here. Then what I am doing? I am bringing the suture and ligating the vessel. বোঝা গেল? So this thing cannot be done by this, as it is almost straight. So in order to ligate a vessel around it, I have to use the instrument. So it is used to ligate blood vessels and it is used to clamp the blood vessels. There is difference between clamping and ligating. বোঝা গেল কি গেল? The clamping process is temporary. Once I remove the clamp, there will be bleeding. So after clamping a blood vessel, I have to ligate that vessel. ভালো করে বোঝ, what is the difference between ligation and clamping? clamping is a temporary ligation, but ligation is permanent. So, and now suppose it is a superficial structure. So then I will hold it like this, and I will suppose this is a blood vessel. It is superficial. I am just holding the blood vessel and suturing around it. It is possible with this instrument if the vessels are superficial, but in case of deep vessels, I will not be able to do this. So I am doing what? I am creating a hole through the mesentery or whatever, the fat tissue or the plane where there are no vessels, and I am making holes around the blood vessels to ligate the vessel. So in this process, this instrument is used to go around the blood vessels in order to ligate it. বোঝা গেল কি গেল? What is the use of this instrument? ঠিক আছে? What is the use of this mosquito or artery forceps, as I was saying? So the layers you are coming one after another. First the subcutaneous tissue, then the fat, then the superficial fascia. In the process of reaching towards your point of interest, you have to get rid of the superficial structure. So what is the process by which you get rid of those structures and go towards your structure of your interest? That is called dissection. That is called dissection. So how do we dissect? We dissect like this. Suppose this is the structure superficial and my structure of interest is beneath there. So we just do this movement and dissect it. So the use of artery forceps is first to clamp the arteries, and second for dissection.
Dissection.
In any kind of dissection, artery is used. Without artery, dissection is not possible. Dissection is possible without artery with one instrument that is not here, that is called fine scissor. This is not fine scissor. See, the blades are not fine. Okay? বোঝা গেল? So to do dissection, fine scissor is used and artery forceps is used. ঠিক আছে? So what is this instrument? Tooth forceps. This is tooth and this is non-tooth forceps. So will I use this instrument with my dominant hand or non-dominant hand?
Non-dominant.
Non-dominant, exactly. So what is the difference in use between these two instruments? Instruments are same, only difference is the tooth here. So what makes it different? So in order to go to a deeper structure, when I said that I want to remove the superficial structure, so in many cases while doing dissection, what I do, I lift the structure with my left hand and dissect it like this. I lift the structure and dissect it. So this is used in superficial structure, that's why the tooth.
Okay.
And this is used in deeper structures. Say you are working around a nerve. So if you use this, there will be nerve injury. Taito. So then I will use this. Okay. So both of these is it. So if you are asked what is the use of this two instrument, what is the use? Used in dissection. Taito. আর ওদের অ্যাসপেক্টে কিছু নেই, ওদের অ্যাসপেক্টে যেটা লাগবে একটু ঝেড়ে পরীক্ষায় না পেলে তো ধরবে। হোয়াট ইজ দিস ইনস্ট্রুমেন্ট?
Riding.
It has a long shaft, box, and see the blades are firm and curved also. Blades are not thin like this.
Okay.
Blades are right, firm enough. Okay, and the instrument is tall. So this is used in superficial surgery or deep surgery?
Deep surgery.
Deep surgery. Okay, so this is called Moynihan's gallbladder holding forceps. Moynihan's, Moynihan's, Moynihan's gallbladder holding forceps. This whole purpose is to hold the gallbladder. Okay. So why not it is used to clamp artery? Everything it matches with the, where is the mosquito forceps? It almost matches with the mosquito forceps. So why not it is used to clamp the, and it is told, suppose I have to clamp a artery inside the peritoneum. So I can use this. Why not it is used? Common sense. Because it is firm enough, it will crush the blood vessel.
Rupture it.
It is so hard, it will crush the blood vessel. বোঝা গেল? So what instrument is used to hold to clamp a blood vessel deep inside the abdomen? One is right angle, another is large artery
Artery
forceps is
forceps.
also there. Okay. So if you are asked what is the use of right angle forceps, what you are gonna answer? Exactly. To ligate a blood vessel. To ligate a blood vessel in a deeper structure. Mention in a deeper structure, not in superficial structure. And also for dissection, because what I was showing you, that around the blood vessels, what we are doing? We are dissecting. Exactly. So where artery forceps fails, right angle comes in. It is used to hold the gallbladder during gallbladder OT. So what is the purpose of holding the gallbladder? Have you seen the anatomy of gallbladder? So what happens? Suppose this is the gallbladder. Here comes cystic duct and cystic artery. Okay. So in order to remove the gallbladder, I have to ligate the cystic duct and cystic artery. But in normal structure, এইভাবে তো থাকবে না. So it remains like this. So you don't able to identify cystic duct and cystic artery. You can identify the GB only if you are doing open cholecystectomy, because I am seeing from above what you are shown in the book is intraperitoneal organ, right? But during OT you are seeing it from above, so you can only see the GB only. You cannot able to identify cystic duct and cystic artery. In order to make it identifiable, you have to lift the gallbladder, because say the cystic duct and cystic artery is supplying the gallbladder like this. If the gallbladder is getting stretched, then only it will get stretched, then only you can able to identify it. So the instrument by which the GB is stretched,
GB.
that is called Moynihan's tissue holding forceps. So what we do, we hold the gallbladder like this and we close the ratchet and lift it like this gallbladder. Okay. So once I lift the gallbladder, then the cystic duct and cystic artery getting prominent. Now which instrument will you use to ligate the cystic duct and artery? Right angle forceps. বোঝা গেল? আচ্ছা. Now look at this instrument. Its blade is quite long, fenestrated and smooth. No serrations are there. Okay? And no ratchet or no lock is there. So when I am using the instrument, I have to concentrate on this instrument only. So now can you getting the point? So what is the function of this? So in order to lift the GB, I was doing it with my left hand, while during ligating the cystic duct and artery, my concentration was on this instrument. Okay. Had not been there, I have to concentrate on this instrument. Just like when I am doing something with this instrument, I have to concentrate on this instrument only, because it has no lock. Okay, so what is this instrument? It is called Desjardin. Desjardin. Desjardins. Desjardin. Stone holding forceps. This is used to hold the stone. So stone where? Stone in the CBD, not GB, because during GB stone we remove the gallbladder as well. But in case of CBD stone, we don't remove CBD. We just remove the stone. If we remove the CBD, patient will develop jaundice, obstructive jaundice. Okay? Because there will be no biliary drainage. So, what we do, we just cut open the CBD and pick the stone with this instrument. This is called Desjardin stone holding forceps used in CBD operation only. It has no use. Just like this instrument, they have no other use. Allis forceps, mosquito forceps, right angle forceps, they have more than one use, but these have only one use. Okay? Look at this instrument. So its blade is fenestrated and also not smooth enough. There is a certain groove. So if we close it, there is a certain gap there. Right? So there is a certain gap. Also there is some groove and tooth like structure here. So this is not used to clamp blood vessel. That is clear. ঠিক আছে? So the gap I said before, if there is something gap, it means it will accommodate something. Okay? So this is called Babcock's tissue forceps. BABCOCK, Babcock's tissue forceps. So what is its purpose? Is to hold tissue. So which tissue? Soft tissue or hard tissue? Soft tissue.
Soft tissue.
In hard tissue we was using Allis forceps. Okay? So look at the difference. So what type of soft tissue?
Any tube, loop or tube.
Loop or tube like structures to accommodate here. So in case of appendicectomy, to hold the appendix, because funda is the same. If the appendix is lying like this and the blood vessels are supplying like this, I have to, just like GB, where the Moini had, yes, just like we are holding the GB, here also I have to hold the appendix, because once I hold the appendix like this, only then the appendicular artery will be visible, which we will be ligating using what? Using right angle force. So in order to hold the appendix and lift it up, it is used. Babcock's tissue forceps. বোঝা গেল? Does this instrument have any use in case of superficial surgery? Why not? Because it is long enough. Not long enough like that regarding if we compared it with this one. এটা কোথায় গেল? মিনি হান্টা। See, intraperitoneally used instruments are large enough. This is not that large. Okay? So, I can use it in superficial surgery also. To hold any kind of tissue, any soft tissue. Fascia, not from fascia. Fascia you need, fascia is hard enough, you need Allis forceps. Say there is a lipoma, superficially placed. Here is a lipoma. So what are we doing to remove the lipoma? First we are giving an incision, the lipoma getting exposed. So finally, in order to remove the lipoma, I have to remove the lipoma from the fascia below it. In order to do that, what I have to do, I have to hold the lipoma. With which instrument I will hold it? It is too strong for lipoma. Okay? This is used to clamp vessels, not clamp tissue. So I am left with these two instruments. So which one I will use?
Soft one.
বোঝা গেল? So after holding the lipoma and lifting it, again lifting, why I am able to lifting it? Because of that law. I am lifting it with my left hand, and then I am dissecting the fascia below the lipoma. With which instrument? With artery forceps. Suppose this is the lipoma. Okay, বোঝাতে পারছি না? This is the lipoma. It is attached with skin all over, and below lipoma what is present? Fascia is present. So first I am removing the lipoma from the skin. Then in order to excise the lipoma, I have to remove it from the base. So how can I do that? By only lifting the lipoma. আমি তো বেসটা দেখতে পাচ্ছি না। যখন I am starting my operation from here, আমি তো বেসটা দেখতে পাচ্ছি না। তো how can I be able to separate the lipoma from the base? By lifting the lipoma. So in order to do that, I have to use this Babcock forceps. বোঝা গেল? Lastly, so after completing the OT, you need what? So this is, what is this called? Needle holder. So to hold the needle, there is a certain groove inside the blade, and also serrations are there. Okay. So this needle holder is large, so it is used to suture structures deep inside the abdomen. Okay. Same with this. ঠিক আছে?
Say it on.
So what is this instrument?
Retractor.
Retractor. Named after some scientist which I have forgotten. Because the scientist is of no use in my life. So this is the retractor, which is of use in my life. So what is its purpose?
Retract that.
Exactly. In order to retract the tissues superficial to my organ of interest, I am using this. Okay? So what is this?
Arey.
Same, just like the funder. Here it is. So it is used. কিসে বল? লাইগেট। আরে লাইগেট কি করবে এটা দিয়ে? এটা একই জিনিস তো। This is also used to retract.
Curve
But
retractor.
deeper structure. It is used in intra-abdominal surgery. And it is used in superficial surgery. So your diverse retractor. DEVAR. Diverse retractor.
DWVER.
What is this instrument? It is a solid instrument. See the numbering are there. Okay.
माउथ मिरर कौन बोला?
So what is this instrument called? So what is the purpose of this instrument? Any idea?
Something related with
Something?
percussion type of issue like but no idea.
Solid instruments are used to introduce to your hollow organs. It may be via nose, right?
Okay.
Via anus, via urethra, any purpose. So what is the use of this? To dilate something. Say something that is stricture. A patient presents with retention of urine. The retention of urine may be caused due to stricture. So in order to dilate the urethra, it is used. It is called urethral dilator. That's why it is solid. In order to dilate it. বোঝা গেল? So urethral diameter are not same for every person. That's why the different size comes in.
Okay.
ঠিক আছে?
ट्यूब के
So
अंदर डाल के
what is this called?
So catheter.
Not only catheter,
ये
also
police catheter.
police catheter, police self-retaining catheter.
हाँ balloon.
Because self-retaining comes in because of
Balloon.
and what is not this is also not complete. Police self-retaining two-way catheter. These are two-way because three-way is also available in the market.
Okay.
Okay. So what is its use? To catheterize. Then simply the teacher will ask what are the other use? What are the other use?
Drainage और aspirate.
Apart from urinary.
Tourniquet में तो use.
What are the other use?
सर tourniquet.
Tourniquet. ठीक है जी?
अरे बाद में.
Okay.
ये वीडियो देखो.
These two things are more or likely same but complete different use.
Okay.
This is the rise.
That's true.
Okay. So what is this? T-tube. Looking like T-tube. Okay. So you don't have to know much about this T-tube. Only know this
Urethra.
that this is used in CBD exploration surgery.
Okay.
In case of CBD stone surgery, this is used. Because many of you will end up saying this is the Riles tube. So you know the tube. This is T-tube. Okay. This is also T-tube. Just it is cut from both sides. It is also T-tube. And this is the Riles tube. बुझा गया? So what is its use? Gastric lavage or to decompress the stomach. Right? Decompress. When we will decompress the stomach? In case of intestinal obstruction.
Okay.
বুঝা গেল?
Yes.
তাহলে এর থেকেই তোদের ইনস্ট্রুমেন্ট আসবে, এর বাইরে কিছু নাই।
Sorry.